Hi, I'm Grace Baroni, and welcome to Conversations with the ERC5. Today I'm delighted to have with us Dr. Michelle Broughton from Brighter Day Physical Therapy and Wellness. Michelle,
Hi.
Welcome to the program.
Thank you very much.
It is a pleasure to have you here with us. So can we begin by you telling us a little bit about your experience, your background as a doctor of physical therapy, and then we can talk a little bit about the pelvic floor and delve into that. But why don't we start with you and your background and how this all came to be?
Sure. So I am a doctor of physical therapy. I entered physical therapy wanting to work with athletes. So I started my career trying to work with athletes. I got a certification as a strength and conditioning coach. Life took me down a different path. The hospital needed a vestibular therapist, so then I was a vestibular therapist for a number of years. The bulk of my career was in orthopedics, treating various joints, and I obtained a specialty certification in spine care. And then after having children, I needed pelvic floor therapy myself, and I was blown away by this niche of physical therapy that was never talked about. I knew very little about as an orthopedic therapist, and it was mind-blowing. So that is how I started my pelvic floor journey. So I took as many classes as possible and was board certified within a year because I was obsessed with how much I was going to be able to help people with their pelvic floor troubles.
Wow. So what caught your interest in pelvic floor? Was it having the children? Because when we do have children, we come out of the experience and our bodies feel a little different. Is that what impacted you so much with that focus on that?
Yeah. So I was a very active mom. I love to exercise and I love to run, and I wasn't able to get back to doing what I wanted to do. It was mind-blowing to me that even though I had symptoms of urinary incontinence and deep hip pain and limiting back pain, my providers never once mentioned pelvic floor therapy in 10 years of having children, over the span of the 10 years. So I went to Google for my symptoms and saw pelvic floor therapy. And when I started to research that a little bit, it was like, oh my gosh, why has no one ever advocated for this or sent me to this? So that was when I took my first course. It was extremely emotional because I was like, I've been dealing with this and haven't been able to get back to my stuff. And I was told this is how it's supposed to be, or this is how it's going to be, kind of like, oh, it'll get better, and
yes.
When I found out there was very simple things that I could do myself to help, I was like, oh my gosh, I have to help other people with this. I have to do this for other people. So.
Well, I'm so thrilled that you're doing this because you just said something. In my previous career in senior healthcare, that's something that you would hear. Like if someone had slight incontinence or, the sneeze and then there's a little leakage. Oh, well, that's just part of getting older. That's just part of it. And as if we were supposed to just accept that, and that goes for male or female as you get older. Yes. And why should that be? Is it a normal part of aging? Does it have to be? And how can we navigate it?
Well, there's 3 layers of pelvic floor muscles, and they have also fascial layers. Fascia is connective tissue. This lies in the bottom of the pelvic base, and they are in charge of supporting our reproductive organs, supporting our internal organs, and sphincter control. So when we get a signal that we have to go to the bathroom, our body has to decide, are we strong enough, and do we know how to control those muscles to stop it, or is it going to, come out? If you don't have control, coordination, or strength in those muscles, then you're going to leak. But those are skeletal muscles. You have voluntary control over those muscles, so you just have to improve coordination, improve strength and endurance in these muscles, and they will improve their function. And so you don't have to live with leakage. It just means that you've lost strength or coordination in those muscles. So the therapy
So that's when I come to you.
Yeah. Mm-hmm.
And you create a physical therapy program
Yeah. So
to guide me through. Can you regain the loss of that muscle? How does that all work?
Yeah, so it obviously depends. Every single patient is going to have different level of dysfunction. So if it's gone on for a long time, maybe there's going to be some prolapse, which is droopage of these vaginal, these reproductive organs into the vaginal canal. So that can complicate things. But an assessment will tell you where you are now, and then we would determine what exercises you would need to do to improve coordination or function. And a lot of that is breathing mechanics, your posture, the way that you move and exercise. That's a huge component to pelvic floor control as well.
Really? See, all of a sudden I kind of sat up a little straighter, because that's something I always hear too. As I'm aging and I complain about something, that your posture and your breath can impact so much. And you touched on both of those.
Mm-hmm. Yes.
So we need to be more aware of how everything comes together.
Yes. The pelvic floor is also in charge of your sexual function. I didn't mention that before, which could be a whole nother episode. But that's also something that, you know, it isn't addressed across the lifespan. So I have lots of young women who have painful gynecological exams, or they can't use tampons, or, you know, they can't engage in sexual activity because of severe pelvic pain. And so pelvic floor therapy can help them be able to do those things without pain. I work with young people all the way up to, you know, very old across the lifespan.
I'm a little older, but those are things that I've heard, you know, throughout my journey, of women who have problems using a tampon or the severe pain. And everyone just assumed that, well, you just got to learn to deal with it.
Yeah.
How do you get help? Because we've all been told, well, it's just part of aging, or it's just part of being a woman. You need to learn to deal with these things. How do you begin the conversation? Is it with your primary care, and ask for a referral? Where do we start?
Yeah, so you have to be an advocate for yourself. I've learned in my own experience. So you have to feel comfortable with your providers, and you have to be able to talk with them openly and honestly about your symptoms. And a lot of people aren't comfortable with that. So if you're not, I love podcasts. So listen to pelvic floor podcasts. A good one I like is the Pelvic PT Rising podcast. Laura Foreman has one. Michelle Lyons has a podcast. And there's numerous books that you can also look at, like the Menopause Manifesto, Hormonal Intelligence, Come As You Are. These are books that talk about pelvic floor pain and changes through menopause. And you can do that in a more private way. A more direct way, I offer free consults. So you can literally just call me and say, hey, these are my symptoms. Would I benefit from pelvic floor therapy or not? And then I would be able to have a very honest conversation with you about what I thought.
Sounds easy enough. The hard part, I feel, is having the conversations.
It
is
is
initiating it. And I think it is becoming easier to do so in the last 10 years.
Yeah.
It has become much easier to talk about the pelvic floor, or I'm having incontinent issues. It's become easier to do that, but it's still a struggle for many to have those conversations. And I think you mentioned menopause, and I think that too is wonderful, because more people are talking about menopause and the effects that it has on us, and how it turns our whole world upside down.
Yes. Skin changes, hormonal changes, strength changes. There's so many changes. And pelvic floor therapy helps women in that part of their lifespan by giving you recommendations on, you know, advising on a hormone use in that region, or adding lubrication during sexual activity, strengthening those muscles to improve the tone. There's a lot you can do in that time frame. And our background and our education supports the lifespan. So we learn everything from, teenage girls all the way up through, postmenopausal.
Which many of us are now. So, but it is good to just know that you don't have to accept these things, and there are things that you can do. So thank you for starting the conversation and for joining us today to talk about this and how we, as you said, advocate. We need to prioritize our own health and make it a priority. How do you suggest we do that? And that goes for men and women, but being a woman, I just think that we prioritize everybody else's health and this and that first, and then we get around to ours. Yeah. How could we change that? Small changes.
So I think it's important to move your body every day. Mm-hmm. And it doesn't have to be for hours. You can just set a low threshold that you can meet, but make it every day or make it consistent. So I set a 30-minute kind of a goal every day, and that might be walking around while the kids are at basketball practice. I'm walking around, or doing lunges on the sidelines of the soccer field during their practice. It's going to be different every single day, but I feel better when I exercise. I mentally feel better. I feel more balanced, and
absolutely.
It feels so good to do. So just being consistent is probably set thresholds that you can meet, and give yourself grace if you miss a day. It's okay. Just start the next day.
Don't be so hard on ourselves.
Yeah. You don't need any special circumstances to start, and you don't need any special circumstances to keep going. Mm-hmm. So it doesn't need to be anything grand. It just literally can be small steps.
Okay. That's good to know. So for our viewers at home, both male and female, that may want more information, how can they get in touch with you?
My website's probably the easiest way. You can email me directly. My phone number's on there. And I have social media handles. All can be found on my website. And that's www.brighterdayptw.com.
Michelle, thank you so much for joining us today, and I appreciate you having this conversation with us. Thank you.
Thank you. I just wanted to make sure everyone understood. We talked a lot about female pelvic floor, but men and women have pelvic floor. It is surprising how similar the pelvic floor musculature is for both genders. So we tend to talk more about female because that's the majority of who I see, but men deal with pelvic floor issues as well. So wonderful. I just wanted people to know that.
Thank you so much. I appreciate that.
Okay.
Thank you.
Thank you.
And to our viewers, thank you for tuning in for this podcast today. If you would like to be the next guest on Conversations with the ERC5, please go to our website, erc5.com, and you could be the next guest here at Stonegate Studios.